Community Care Collaborative and
Community Care present Depression and General Anxiety Disorder and Tobacco Cessation Protocols.
My name is Veronica and this is my colleague Stephanie. As part of Community Care, we aim to provide the best care possible to the community we serve. You are a big part of how we will accomplish our mission. How successful we are in our initiatives to help our patients depends on you. We are enhancing what we already do to align with the best practice recommendations for improving the tobacco cessation rates and addressing depression within our communities.
The Improved Care Century, our disease management registry, designed to help us work more efficiently and effectively. Remember to open Care Century NextGen by clicking on the correct icon as seen pictured above. When you open your patient's chart, this pop-up box will automatically appear. It reminds you that what screenings and tests are due at the patient's visit. This will make chart prep a lot easier and faster. Since the accuracy of the disease management registry relies on us to complete our documentation with the right information in the right area, following the established protocol is vital. You play an important role in helping the DMR capture the correct data, which helps make it easier for you and your team members to provide better care.
You might be thinking, why do we need to screen for depression? The CDC cites that depression is the most common type of mental illness affecting more than 20% of the U.S. adult population. More than 1 out of 20 Americans 12 years of age and older reported current depression in 2005 and 2006. Because the symptoms of depression may be subtle, many cases of depression are not identified or treated. By screening every patient at their primary care visit, you play a crucial role in helping those suffering from depression get the care they need. You may be surprised by some of the other facts. Major depression is the leading cause of disability in the United States. Approximately 20% of Travis County adults experience 5 or more days of poor mental health in the past month. And people with depression are more than 4 times as likely to have a heart attack than those without a history of depression.
Because depression is the most prevalent and treatable mental disorder seen in the primary care setting, our goal is to be better at identifying and treating depression in our patients. We aim to reach this goal by using the quick and easy PHQ-2, the 2-question depression screening tool at each primary care visit for all patients 18 and over without a diagnosis of depression. If the PHQ-2 is negative, all is good. If any response is positive, the PHQ-9 link will appear. The MA should click the link and go over the PHQ-9 with the patient. Please note that the first 2 questions are the same as the PHQ-2, and NextGen automatically transfers the patient's responses to the PHQ-9. Clicking Calculate will display the diagnosis, score, and interpretation. The MA should administer the PHQ-9 to all patients that already have a history of depression at each visit. If one should be done, this is how Care Century will let you know.
Some patients that are being treated for depression may be taking some medications that require monitoring for certain metrics. For example, blood pressure should be measured at each visit if the patient is on venlafaxine or Effexor. Weight should be recorded at each visit for someone taking mirtazapine or Remeron. Care Century has been programmed to remind you of this. This is a screenshot of how the alert will appear. When administering the PHQ-9, question number 9 is extremely important because it assesses the patient's safety risk. If the patient answer choice is anything other than not at all, Care Century will automatically send a pop-up reminder for the provider to conduct an urgent patient risk assessment. Remember, if question 9 is positive, ask your patient if he or she is currently feeling like harming themselves. If yes, notify provider immediately and get BHC assistance.
You now understand how and why every primary care visit we need to complete a PHQ-9 for all patients with a history of having been diagnosed with depression, and a PHQ-2 on everyone else.
Scientists have found a relationship between smoking and depression. Did you know that a recent study found tobacco use increases the risk for symptoms of depression? Patients with depression tend to have higher rates of smoking than the general public. Nicotine dependence may increase the onset of psychiatric disease, and current smokers have a 40% higher risk for having severe depression. And as you may know, one of the biggest public health problems in our community is the use of tobacco and other nicotine products. 1 out of 3 cancer deaths in the U.S. is caused by smoking. More than 1 in 6 adults in Travis County smoke or use tobacco. Tobacco is the #1 cause of preventable deaths in Austin and Travis County. Tobacco causes more deaths than AIDS, crack, heroin, cocaine, alcohol, car accidents, fire, suicide, and murder all combined. In 2007, almost 600 deaths in Travis County were caused by cigarettes and other tobacco products. That's an average of 11 people every week. Smoking causes diminished overall health, such as self-reported poor health, increased absenteeism from work, and increased healthcare utilization and cost. As you can see from this graph, current smoking status among adults in Texas and Travis County, Texas has 16.8% and Travis County at 11.3%. This is just a graph that shows the demographics of current smokers in Travis County. Now think about our patient population. As a community, we are striving to protect the public by creating more smoke-free ordinances. We have increased from 20% in 2006 to 55% in 2011. The DHHS report that each day in the United States, more than 3,800 youth and 18 years or younger smoke their first cigarette, and an additional 2,100 youth and young adults become daily cigarette smokers. They also cite that although cigarette smoking has declined among middle and high school students in recent years, the use of other tobacco products has increased. 43% of non-smoking adults and children are exposed to secondhand smoke. 3,600 non-smokers die of heart disease each year in Texas from exposure to secondhand smoke. Asthma symptoms are more common and more severe in children exposed to secondhand smoke. In response to this, the CUC has adopted screening for nicotine use for all our patients age 13 and older.
Although tobacco use is on the decline, it's still a major public health problem that greatly affects our community. Smoking is still a leading cause of death, as well as numerous preventable chronic health problems. Remember, the protocols are being implemented to provide preventative and chronic care services to our patients. By enhancing what we do already with best practice recommendations, we hope to improve tobacco cessation rates and address depression within our communities. It is our goal to provide the best care possible to the community we serve, and you are a big part of how we will accomplish this mission. So don't forget, we are here to help. Remember,